scream aloud. Children, but I would ask that all of us respect each other. That was not the case at our village board meeting, and here in the public. You don't respect each other, you'll be asked to do. There will be absolutely no applauding at comments. We will listen to the comments and we will listen to the presentation. And the goal is that at the end of this, no matter what's decided at village board level, that we all be okay with the decisions that are made. But we have to start by being respectful, and that is going to be the case here today. We will be respectful toward one another, and we will ensure that we respect your time as you respect our time. Okay, public comment is very important, although it's a privilege, not guaranteed. So we want to make sure we hear from the public. That is part of why we're doing this and why we're doing all the listening sessions. I think this is just another one of those venues where you can get informed, ask the questions, make your opinions, those kind of things. But we have to absolutely respect one another. And I would really appreciate that compliance, so we don't have to ask anybody. I think that's just embarrassing. We are better than you. So without further ado, I'm going to have our chairman, Sarkis.
Well, I'm starting the meeting to say, like to call the public safety meeting on Tuesday, August 19th, 2025, to order. Roll call, please.
Roll call. We have Randy Swingham here, Cameron Torkman
Here.
Candace Montag
Here.
Tammy Roll
Here.
Kevin England.
Here.
All present.
All right, please stand for the pledge, please. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Presentation / recognitions. Oh,
Okay, everybody.
did I hear every? Yeah.
Otherwise, we do.
There are people online though, so we want to make sure it's loud enough
Okay.
that it picks up on my laptop.
This. Okay.
Yeah, thank you.
Okay. Okay, presentations and recognitions.
We have none.
We have none tonight. Okay, moving on to public comment. This is an opportunity for anyone to address the committee on any issue. Please observe the time limit of 3 minutes while the committee encourages input from residents that may not discuss or act on any issue that is not duly noted on the agenda. And then just before we get into it, I would like to echo everything Chief Tony said. You know, we want to have a productive conversation, right? And we want to make sure that all of, the facts and the pros and the cons get on the table. But for us to have a productive conversation, personal attacks, we can't have that. That's not helpful. And another reminder that this group, the Public Safety Committee and the Village Board, right, are going to be making decisions for the Village of Cross Plains, right? We do not represent the town of Cross Plains. We do not represent the town of Middleton. We do not represent any of those folks. They have their own representatives. So again, just to try to, zero in, try and help you guys with public comment and keep it productive and make sure that, everyone's getting the correct information to the right people. All right.
Yeah, pretty much here, so just talk. Okay, when I call out your name, just come up to the podium and tell us who you are and your address and yeah,
Thank you so much.
Paul Park. Thank you, Paul.
Hello, friends. My name is Paul Barb, and I am a member of the Finance Committee. So if you're wondering who the Finance Committee might be, I'm one. And I want to say that I joined it this year, and I came into the conversation to help specific to public safety, thinking about our police, fire, EMS, making sure they're well funded, they're well supported. They're building a culture that fosters professional development and they're promoting partnerships. And I think the takeaway for me in looking at the analysis we did in the Finance Committee and some of the subsequent feedback that I have that I have gotten, is about evaluating all of the alternatives, financial, cultural, collaborative. And that I hope today we can have a discussion that is focused on all those dimensions. And I appreciate what this committee is doing and all the feedback from the committee. And I just wanted to be present to support this group and the village board. So I just wanted to, I was hoping to focus on the positivity, the collaboration. And I feel the energy, I hear the concerns, and as a fellow citizen, I share a desire to live in a community where my children want to live and where I want to retire. So thank you for what you do. And with that, I'll set aside. Thank you.
Hey, Chief, we need name and address for every person. They need to state that.
Paul Barth, 2060 Glacier Circle.
Great, thank you.
Again, when you come up, if you just come up, state your name and your address. Okay, you're up to the test. Kelly Pop.
Just kidding. Ellie Powell, 8813 Airport Road. I'm here tonight yet again to express my deep concerns with the Finance Committee's ruthless idea to have the Village of Cross Plains take over EMS. First and foremost, the financial analysis that will be presented tonight does not have factual content in it. There has been dishonesty and far from transparency when it comes to this research. This district has operated successfully for over 45 years. Has it been brought to anyone's attention that if the district dissolved, not only would it completely taint the EMS service, but if you're not part of a district, you will lose out on levy limit exemptions. But most importantly, look at the lives you're putting at risk. If the village takes over, there is no guarantee the other municipalities will contract with the village. And in fact, all of them have stated they will look at other options. In the letter that was sent out from the village president to the community, a picture was painted that the village's portion of the EMS budget is over $735,000. Let me make this clear. That amount is split between the 4 municipalities. The village's portion was $286,000, which is significantly less than any other village department. Would your community members rather see their taxes skyrocket if the village takes over and must pay the full $735,000? Or is it in the best interest for the district to remain operating as it is today and the village pay their percentage of the service they use? I'm not sure if the Public Safety Committee has read the letter from the Wisconsin EMS Association CEO, but I'm happy to hand out copies as well. But as a member of EMS and a resident within the EMS district, listening to an expert on EMS and how these districts are to be operated and following rules and regulations and what's in the best interest of the community is the route I sure would take. I've been a member of Cross Plains EMS for 5 years, and I was part of this service when we had 8 volunteers. I was running sometimes 5 days a week to ensure the rig gets out the door. I was burnt out. It was taking a toll on my mental health and my family. I can confidently tell you I would not be doing that again. In addition to our full-time staff, we have almost 30 volunteers. You do not hear of this anywhere in the state. We have built this service up so much in the past few years and have a very bright, profitable future. I can assure you if the village takes over, this service will completely dissolve and you will no longer have anyone to answer the call. I strongly suggest members of our Public Safety Board to express these concerns and ask that you do not recommend that the village take over EMS. Thank you.
Next, Freedom.
Katrina McKee, I live at 2214 East Street. Good evening. You heard from me last month at the village board meeting. I'm here again tonight to reiterate what I said before. We're headed down a dark path. Dismantling Cross Plains EMS district as it currently stands will have negative detrimental effects on our neighbors and our community. Many of our community and neighbors spoke out at the last meeting. Our medical director, as well as the CEO of the Wisconsin EMS Association, have written letters in support of our department, explicitly stating that this idea of dismantling our department as it currently stands is going to negatively impact our community and those we serve. Options 1 through 3 will lead to increased costs to not only the members of the village of Cross Plains, but also our surrounding communities. It's going to lead to extended wait times for those waiting for emergency medical services. It's going to lead to negative outcomes for those suffering medical emergencies such as cardiac events, stroke, trauma, sepsis, and mental health claims. It's going to lead to our communities having higher taxes. It's going to lead to our village board asking for referendums for more money because starting a service from ground zero costs a lot of money. The finance committee and the village president have failed to prove that leaving the district has any benefit to anyone time and time again. In the letter sent out by President Jay Langfeld, he cited costs for the village services such as the police department, the Parks and Rec department, and the village works department. However, he failed to mention how much the village pays for the fire department, yet another vital emergency service that is also shared by multiple municipalities. Something that would be a comparable cost analysis for the village of comparing cost of shared services is truly President Jay Langfeld and the Finance Committee's goal. I stand before you tonight to ask you, the Safety Committee, to review the facts before you, look at what the Finance Committee has presented, listen to what the public has to say, listen to what the experienced members in EMS have to say, listen to those of us who have seen this happen, to those of us who don't want our community to suffer because someone wants to change the way things are. I urge you please to think of your neighbors, your families, your friends, think of their health and safety. Who do you want to show up and give them the care that they need when they need it and in a timely, effective manner? Please tell the village board that the only option is option 4. Leave Cross Plains EMS district as it is. I stand before you as a 10-year veteran of Cross Plains area EMS. I was part of EMS before COVID. I served all through COVID. My husband and I served 7 days a week, 24 hours a day on numerous occasions. We missed so many things serving our community, and a lot of this is baseless because taking away what we have is going to be so detrimental to our neighbors that are just across our borders. I know that's not the village's concern, but think about the people that live just outside our borders. To those of us who serve, this is what we do, we care, and it's heartbreaking for us to know that those people are going to be the people who lose. They are going to lose out so much. I'm also an ER nurse, and I have seen what happens when help doesn't come when it's needed. Those people who could have survived that heart attack, that cardiac arrest, they're dead. Those people who have a stroke, they have lifelong detrimental effects. They will never be the same because help didn't get to them fast enough. Those trauma patients, they lose limb, they lose function. Those mental crisis patients, instead of it being a suicide statistic, they could have gotten the help they needed. Those are the people that we want to be able to serve. And if the other municipalities pull out, those are the people that are going to suffer. And that's what we want to avoid. That's why we are asking for the support to go to the board and say, we want option 4, leave the district as it is. That's what we're asking for everyone to come back to the board and say, go for option 4, leave our district the way that it is, please.
Last, Linda Neighbor.
Neighbor.
Linda Niebuhr, 2029 Julius Street. And foremost, what I wanted to say first is I'm sorry if people's feelings got hurt at the last meeting because their feelings got hurt. But there was emotions were running high, and because this service means a lot to this community as it is. As some of you may not know, I have been here since 1953. And what I do realize, especially because both my mom and dad served this community in many, many, many capacities, including the president of the village. During which time, many services were brought and shut down, but because of that tenure, we have PI here. We have a water tower on top of Tubbs Hill to serve PI and others. We have Bayer Park. We have Park School. We have the swimming pool. And this was all during the time that my dad was on the village board and my mom was a member strong in the community with St. Martin's Lutheran Church. So I am here to say this is a community. Middleton is not our community. Wanakee is not our community. People who have moved out from the University of Wisconsin or the University Hospital System or any other, people that feel that they might be able to govern our community better than those of us who have lived here our entire lives, just take a look. And understand that this is a very powerfully tight community because we have been through a lot ourselves. I remember when the volunteers fire department first started, which had my dad and all my brothers on it. My dad was also the electrician lineman for this community. So I know firsthand about people and their not so niceness sometimes calling up. But my dad always said, well, they don't know the whole story. But he still said, we're a community and we work together. So that is why with this community, we support the volunteer fire department and what you have to pay for that way. We support the EMS. We support the communities of any kind of aid that can help from our tax dollar. But what we don't support is our taxes being raised because maybe somebody somewhere wants, but that being beside itself is a different story. I just want you to know that these people here, I grew up with, a lot of them are, just good-hearted people that all they want is to have a safe community to live in, a clean community to live in. We watch out for each other. Middleton will not watch out for us. They could give a rat's ass about what happens out here. And so, just keep us safe with the EMS people that we have. Keep us safe with the volunteer fire department that we have. And understand that when these services are needed, should you decide that you don't want them here, then you get what you vote for. So I just want to thank the community because you've always been a supportive community. And we all help each other out here. And I have never seen one person from Middleton come out here and help us when we kind of need. So thank you very much.
Is there anyone online that would like to speak? I don't see anyone's hand raised, Chief. Yep. Yeah.
Bobby Bonner, live at 2113 Maple Street. I have been the village's finance director and treasurer for 9 years. I just wanted to clarify something. I heard the last meeting and then maybe online and then again tonight about that the village would lose a levy limit exemption. And I guess I don't understand where that information is coming from, as I am the one who fills out our levy limit worksheet every year. There was some legislation proposed earlier this year or last year for an exemption for a regional EMS service. Regional is 8 or more municipalities, which we're not, so we're not considered a regional EMS district. So there's no exemption. Again, I'm not sure where that information was found, but I just wanted to let everyone know that there is no exemption for EMS levy limit. Thank you.
Do we have folks online with public comment?
Nope, we do not.
No. All right. Okay. Moving on then, approval of the minutes from June 17th. 5, I have a motion. Motion and a second, any discussion? All right, all in favor, say aye. Aye. All opposed, the same? So moved. All right, reports from the people, I guess, starting with me. I don't have anything, well, noteworthy to talk about. Just again, I appreciate everyone's involvement in the full discussion. Everyone coming to the last village board meeting. I wish that we get half this kind of attendance and feedback on half the decisions we made and talked about. So it's really great to see the community involvement, and, I hope to have, continued positive discourse, throughout this meeting. and others. So. Members. Any special guests tonight? All right, moving on to report of the first responders. Ollie, start with you.
So instead of giving your report, I'm just gonna, as the current Cross Plains EMS chief, I'll again warn you what the village president and finance committee are presenting, suggesting we'll lead the village down a very dark and catastrophic road that will absolutely obliterate your current EMS. As it stands, you have heard warnings from me since the finance committee started this project in February. I have letters from the state of Wisconsin EMS Association that not only agrees with me, but also feels the letter from the village was purposely misleading. I have a letter from our medical director, from Dr. Charles Pierce, asking you to leave the system alone, and a letter from our bookkeeper stating that books have never been cleaner or up to date. As this fiasco continues, you will receive letters from other municipalities asking you to keep the district together, or they will leave and give their territory to other providers. There is no financial benefit to take over. If the village does take over, it will increase prices to the patients just to try to make ends meet. One question you should be asking yourself is, how long am I willing to wait for an ambulance when your loved one is in crisis or having a massive stroke?
All right. Chief Radke, he said he's gonna join us online.
Yeah, I think it was on here. Justin, are you available to give your update?
Yep, can you hear me? Can you hear me? Can you hear me? Can you hear me?
I can't
Hello?
hear you, Justin.
Can you hear me? Can you hear me? Hello? Can you hear me?
Oh, they can hear us. So I think if there's a problem with the system, do we know how to hook up the audio on here?
I think the audio is connected, but it dinged when you did the speaker. It's just the Zoom output is not going to the right place.
Okay.
Yes,
So I would go here.
I think so.
Okay. Here we go.
What? Oh, yeah.
There we go.
Oh, select speak. Oh.
Room.
Oh, that's what it, okay, well then pick. Yeah, try again.
Okay. Can you try speaking again, Justin?
Can you hear me now?
Okay. I think we got it.
Can you hear me now?
Yes.
Hey, 5 years into Zoom meetings and I'm still screwing it up, sorry.
No, I think that was it.
Okay. Fire department, 87 calls for the year. A little over 50% of those calls are in the village so far again. We put on a new member, Carrie McKee. We put her on last week. She'll be starting classes this fall. We had last Friday night, we had a car accident on Highway 14. We had a firefighter injury. He was transported to the hospital by Cross Plains EMS. Overall minor and minor injuries. He's doing well. Went back to his normal job on Monday with just kind of a take it easy kind of direction from the doctor. So thanks to the crew from EMS from Friday night for that transport. And then last I have is next week we have our district meeting next Tuesday night, 7 o'clock. Just our preliminary budget meeting. That's all I have.
Thank you, Justin. All right. And Chief Tom.
All right, for the police department, first of all, I want to thank everybody that attended the National Night Out event. It went very well. fire EMS, again, for just being part of it, helping us plan it. It was great. It's another great year. Special thanks to Kelly for being Nikki's break-in person. So I really appreciate all the hard work. Officer Esser is about a few days off of, before he's off field training, so you should be seeing him in his own squad car here soon. It's been about a 13-week process, so he is doing great, and we look forward to him serving the community. As far as the police department goes, I'm just gonna be quick about it. We have, year total, we have 2,825 calls for service so far. We're well on our way to beating last year's total, which was 4,200 calls, which is way more than any year before. So we are busy. A lot of calls for service, a lot of interesting calls for service, some serious calls for service. Actually, one of our officers is on a very serious call right now. So I appreciate the partnership. That I can't say enough. Anytime we need help, fire EMS is there, and we do a really good job working together. So that's all I have, unless somebody has any questions, specific questions.
Excuse me, I don't have a question, but there's something I forgot to say, which is, for the Monday night meeting for the village, that I think is gonna be at the fire station. I do believe that this hall would be available with the PA system for next Monday night's meeting.
It's not Monday, it's Tuesday, the 16th of September. Okay, yeah, the village board meeting is Monday, but this is not on the agenda.
Okay, the EMS is not on the agenda, village board meeting on Monday.
That is correct. The village board will take this up starting in September meeting. Yep.
All right, moving on to our items tonight, no action tonight, just discussions. First one is on the emergency medical services report from Jay.
Right, you guys want to move and I'll bring the mic over here, so everybody here.
No. Where you want me to go here? I'm just gonna. You're fine.
Yeah, that would probably be helpful, wouldn't it?
You guys wanna sit on this side of it? I'm all right. Okay.
Right, can everybody hear? We're good? All right, so we have heard many times for the last 6 weeks on what my motives have been and what I'm proposing. So tonight, it's coming from me. I'll tell you exactly what we've been working on and the history to it and all that. So we'll get started. First slide, please. Oops. There we go. So neither the agreement or the report that came out of finance or anything that we've talked about will change any of this. We did not touch any of the services or parts of it. So the quality of service, we didn't change personnel, we didn't change how they deliver, not even talked about. In none of those documents will you see anything on that. Level of service, we are at the advanced EMT. No discussion of moving up to paramedic, no discussion of dropping down to basic. Zero, not talked about, never mentioned. We go to response time. We are not talking about moving the station at all. Response time is pretty simple, going from A to B, right? That's it. Nothing has changed on response time. We have not discussed response time. In the report, as data, we have captured response time that we got from Dane County EMS service. The policies, the standard operating procedures, didn't review, didn't talk about, all stays the same. The wages, benefits, didn't talk about them, not discussed at all, stays the same. Scheduling stays the same. From an operational perspective, EMS's operational part has not been discussed in any of these venues, has no recommendations, and there should be no changes to it. The only ones that can make changes to that would be if the towns chose to do things. But from a village standpoint and from what finance and from what the agreement talks about, absolutely nothing. Absolutely nothing. Next one, please. So I wanted to just so this is my goal. My goal, and it's not going to be a surprise to anybody, that I believe we need to develop a new district agreement or terminate the current. That is the goal. Everything we've done is to go towards that goal. Now, this is nothing new or unique to Cross Plains. I think if you watch the news, every year there's a district going through this, looking at their agreement. Fitch Rona just passed theirs last week because one of their members was feeling that it was not just for them. They got together, redid the agreement so it was much more fair, and they passed it last week. I am totally open to that. I have no problem with keeping the district together, but agreement has to be changed. And tonight you'll understand why I feel strongly about this. So other places, let's talk about Arena. That was just a year or two ago. They went through this. Marshall, a couple of years went through it. I contacted to part of the finance committee. I talked with Ryan Brothers. Fort Atkinson is dropping contract service and they're going on their own. Lake Mills is dropping theirs and going to contract services. So everybody's discussing this. And there's nothing wrong with us as a community to have this discussion and look at it. I'm not voting one way or the other. What I'm saying is, hey, as village president, I see a concern with the current agreement. And I have seen this for many, many years. This isn't something I was just thinking of. Years I have been working on this. I have started in what I would call informal, bringing certain things that I felt was unfair to the village to the board, the district board. And the letter that people are talking about even says that's the venue you should do. Did it. Got zero response. Basically, it's your problem, not mine. So then a year and a half ago, the village board came up with a proposal to the district board on making changes to the agreement to balance things and be more fair. That was denied. No counter offer, no nothing. So it's not like this is coming up. So we're left for the village of Cross Plains. We don't have many options. We basically have two. Keep it the same, which I think is not sustainable, or we need to make a change. All right. Go to the next one. So when we go through this, it's important that you understand what these parts are. So the district board is basically the governance of the EMS. All right. There's one member from each jurisdiction that's on that. So there's 4 of us. I represent Cross Plains and there's one for each town. So they're the ones that meet 4 times a year and basically are take care of mainly the budget and other potential issues that may come up. The agreement is a 26-page document that gives you the structure basically of the district board. It has the rules. It tells you who the officers are being, how the money should be split, how the voting should be. It has the structure in the system for basically EMS and this district board. Now, the report I'm calling, that is the report that finance did. And that's what kind of got this going is obviously we had transparency, so we weren't doing it in any type of hidden behind black doors. Anything like that, it was there and people saw what we were working on. The problem is they made the assumption that was the goal. That wasn't the goal. Finance, as again, we'll talk about, is for the village, kind of our research and development group. So if we can't get an agreement with the other jurisdictions and we want to void and get out of the agreement, the only option we have left is to leave the district. Well, you don't gonna bluff with that. You're gonna have a plan. You're gonna have to look at what are your options? What is the cost gonna be? How are we gonna function, right? That's what finance did. They worked probably 4 or 5 months on developing the different options and putting the cost to it. And if you've looked at that, not only did they do that, they brought all kinds of data from EMS into one place. And it was difficult. We really had to search for some of that data. And in that report, you can see where some of the data was incorrect and we had to modify it just to make the numbers work. So that's the report. And that is the step that would be used if we can't get the other jurisdictions to sit down with us. So then that brings us to option 1, and that's what you've heard a lot. It has nothing to do with dismantling EMS. It's basically bringing them, merging them into the village system. And we'll get through every one of these to break it down. And you'll see, you've heard all the cons, and I will share with you the pros that go with that, if that is. The 5th thing that's not on there, and it was mentioned, there's I'll just use it in Mr. DeYoung, who's the executive officer of the Wisconsin EMS Association, wrote me an open letter and sent it to people. So I'm going to add that on because it has important information in the sense that you need to have perspective. I think it's poorly written and not truly, but we'll walk through it and you'll see what I'm talking about. So that when I say Mr. DeYoung, that's what I'm referring to is basically, or I could call it the letter, but I think it's more appropriate to use the author's name. So these are the 5 things that we're going to be looking at, and you kind of have to have that understanding of how. All right, next one, please. So the reason is why now? Been working on it for 2 years. Why do we have to do it? Well, the agreement that we have for the village, the agreement for the board has it where if you want to pull out of the district, you have to notify everybody by December 1st, 2 years before the agreement ends. Now, these are 5-year agreements, even though there's a clause that says the agreement stays in place until a new one is passed. The current one was signed in 2017, so it's an 8-year-old agreement, but if you pretend it renewed itself. So if we don't act now, we would have to wait until 2030, and implementation would be in 2033. So you're looking at 7 years from now. If we don't act now, then we could implement something. That's a long time. And it's just the way it's written. And again, in here, which is Mr. DeYoung's report, talks about that this is the venue and this is how the out and stuff. So that's right there. So that's the reason why we are talking about it now. We've tried the past couple of years to get it different ways. It hasn't worked for us. This is the option we have left. Otherwise, we have to wait. All right, so let's get to what we see as why I think we need a new agreement. There's a financial impact that we'll go over to the village, that this agreement. There's a district's board authority that we need to talk about. And then there's the oversight, accountability, and transparency that really needs to be talked about. Those are the reasons why this new agreement. So let's go to the next slide. This seems to be the one currently that really bothers people. This is where people are feeling that this is a comparison of apples and oranges, and that we should be using, it's not fair to use a district-based agency to a village individual. That's not the purpose. I have never said that the budget of EMS is unreasonable or not justifiable. The comparison is not to show which one, because they're almost as much as police and they're more than public works. That's not it. And if you read the letter that I wrote, it's to show that when this agreement was made, we were a volunteer service. We are now a paid service. We certainly have volunteers, and they are very critical to the operation of EMS, but you can't tell me that a budget of $735,000 is a volunteer service when you're looking at all these other ones are full-time services. Police, village works. So the purpose of this was to show that the amount of money, so you have a comparison of what we're spending in other departments to show the amount of money that EMS is. But again, it's not to illustrate, and we didn't talk about it, that this is too much. We didn't break down the budget and say we should save here, we could save here, this is wrong, this is right. It is what it is. And what it is we've moved from a volunteer system to now a paid. Now, I'm going to bring up in Mr. DeYoung's letter, he feels that I'm deceiving the public on this. Because what he's saying is you can't compare because of one's a district and one's a sole entity for a village service. And then he mentions that our share, which is true, is $286,075. And that's only about 40% of the total 735. It's important that you keep thinking of that number because that'll be coming up later in this discussion. But what I found interesting in his analysis, when you look at this, and he's correct, that we are paying this 286 is about 40%. And if you look at the other districts, they're paying about, when you're using how he wants to do it, it's about 30%. So so that equals 70%. So where is the 30%, the last 30% coming from? He doesn't mention it in his letter, which I found interesting, but EMS is a user fee service. When the ambulance goes out and goes, there's a charge. All right, of that $735, about 240,000 of that comes from fees. And the fees are coming from them going to calls. So if you look at the numbers, and it's been said many, many times, the village occupies 65% of the calls. Right? We've been told that. It's true. So you can say, now you could go down, look at all 522 calls and see how much was charged and how much we got. But if you use that number, about 150,000 to 160,000 of that is coming from village residents. All right. Now, we get that different ways. If someone has insurance, they can use insurance. But if you don't have insurance, you pay it. You get billed. Many of us that have insurance have deductibles. You're gonna have to pay your deductible on that. Many of us have co-pays that we have that. So you're gonna pay for part of it comes out of your pocket. And you can say, all right, the insurance pays the rest. But I'm telling you, everybody in this room knows that health insurance premiums are not cheap. So the village residents are really paying another 150 to 160,000 towards that budget. Now, I thought, if you want to be someone who's thinking deceitfulness, why wasn't that put in his thing? He knows that we're user-based agency, EMS. So I just wanted to point that out. So, and it's interesting, so I'm going to, the next slide is what everybody's been looking for. You know, he wants us to compare apples to apples. He wants it to be to something with the district. I heard one of the speakers say, why aren't you comparing us to fire? Well, we are. So let's look at fire and EMS. Fire and EMS both have an agreement. They both have district boards. Fire has every member on their district board that EMS, the only one that EMS has that fire doesn't have, Springfield, town of Springfield. Okay, they have a chief. The structure is pretty much the same. The billing, the power is pretty much the same. The wording's a little different. So let's take a look even up there when you look at this year here. 2019, what this graph is showing, to be totally transparent and understand, this shows the percentage of our levy limit funds that go. And the reason percentages are important to use is because you want to build in the growth of our community. If you just use dollars, you don't get that. When you use that percentages, it shows that you're taking into consideration the growth that Cross Plains has had, and it tells you the percent. So when we look at this, in 2019, EMS made up 2.3%, and fire made 3.3% of our levy limit costs. All right, that's pretty close. So you can see that they're pretty similar. Now, you guys don't have to write all this down. We can send you this PowerPoint. It's going to be a lot of writing. All right. Well, then you look at in 2020 through 2025, you look at EMS is going from 2.3% up to 7.9%. When you look at fire, they're at 3.3 and they go up to 3.4, and there's some movement. But if you look with fire, they're about that 3.5, give or take 0.2%. And the reason that's consistent is that they are a volunteer department and has stayed volunteer. EMS, on the other hand, has gone from volunteer to paid. All right. Now, again, I'm going to emphasize, I'm not saying that they're spending too much or anything like that. But the fact of the matter is they have moved from 2.3 to 7.9. So they make up about 8% of our levy limit. All right. And we don't have, when I say we, I'm talking about the village board, does not have say on that. All right. And we'll talk about that a little bit later. But this is your apples to apple comparison. First responders, 24/7, agreement, district boards, voting, the same thing. All right. So now let's go to the cost factor, the dollars. All right. So then you look at, you can see, because percentages, again, it's hard to put it in perspective. You want that for looking at growth. But now when you look at the actual dollars, and I went to 2024. So, you know, that's why there's a $10,000 difference. In 2025, it went up 10,000. But anyways, you can see again, which shouldn't surprise anybody when you saw the percentages, even though fire has gone up 61.5%, their percentage of levy limit hasn't, because the village has grown. And then you see with EMS, it has gone up 489%. Again, number one reason we went to a paid staff. All right. And why I keep emphasizing that is that's a key point to why the agreement is outdated. The agreement has been for decades, and the last one, the 17th, and you see the changes since then. It needs to be updated. So let's talk about now. So that's the finance part. Let's talk about the district board authority and how it kind of works, because it's important. So, as I mentioned, there's 4 of us. We all get 1 vote. Kind of like the Senate, right? 1 district, 1 vote. 1 jurisdiction, 1 vote. The agreement, and that's in the agreement, and the agreement says how you divide cost is you take population and you break that down. Our population runs, I'm going to use 60,000 because it's 60% because it's easy to do the math on that. Last year we did 58.4, the year before was 59.2. It's going to be up there. So it's done by percentages. Now some people, and I would agree at some point, that should a jurisdiction that pays 60% of the cost get 1 vote when someone who has 10% pays 10% gets a vote. All right. And when you look at this, where this comes really into play is that we do 60, the other 3 are at 40, which comes out to about 13.3%. What's the financial incentive for them not to approve financial things? So when it comes time to buy a new ambulance, you know, we've got to pay 60% of it. They have to pay 13%. And I don't blame them. If I could get a new ambulance for the village of Cross Plains for 13%, I'd jump on it any day. All right. So again, and they're balancing it with population, and it's true, we already mentioned calls for service, right? We spend so there is a legitimate basis for that, and I can't argue against it. There's still an imbalance, I think, but it makes logical sense. And a lot of places use population. Now I mentioned Verona and Fitch-Rona, right? And their thing was Verona, they were using equalized value. And what's happening in Verona? You have Epic. Think of all the buildings that are going on there and how big. So they were paying 61% of the cost and only using 40% for calls for service. So what they did, they adjusted their agreement, and the chief has brought this up. They're using calls for service, they're using equalized value, and they're using population. And that seemed to work for them. All right. So again, it's not like there aren't solutions out there. There's really easy solutions. So the next one, the blank check. This one really bothers me because technically, legally, the people who are supposed to, by state law, decide the budget for a municipality, a village, is the village board. But here, the district board has all the authority. They basically make the decision. We pay 60% of that, and they send it to us. And we have to adjust our budget to meet that. They get first dibs at the money, right? Now, I don't think that's fair. All right. I think there's an easy solution to that. Why not have it where the district board can spend up to, let's say, 3%? If they spend or need to spend more than 3%, they do a supplement budget request, and it goes to all the jurisdictions, boards, and they have to pass it. There's your checks and balance. There's where there's some oversight, there's some accountability, right? No one should have a blank check these days, nobody. All right? So then it kind of goes into the same thing with the blank check. They have the decision power, right? They can make whatever decision they want as long as it's legal, and the village board has to go along with it. Okay, there needs to be some type of cap to that, and I'm gonna go through an example a little bit later that got people riled up a little bit. But I believe major decisions should be kicked back to the boards of each jurisdiction. They should have some input into it and some control over it. So the other one on here that no one really talks about, and what probably scares me the most financially, is in the agreement, it allows townships to adjust their borders. So you think, okay, what's the big deal there? Well, every time they adjust in a negative way, we get hit. And it's giving boards way more control of it. So let me give you an example. Town of Springfield has been talking about it for a year or two, and I don't know if it's actually happened, but they were looking at giving some of our district to the Middleton district. So let's say it's 5%. Well, someone's got to make up that money, right? That we're losing. And it's the village that's going to end up paying 60%, maybe a little bit more because they've lost population. So our population goes up if you use the formula. But there's even bigger concerns, I think, in the horizon, because I've heard talk. We know that the town of Middleton is looking to incorporate into what they're going to call the village of West Middleton. What if they decide that they want a EMS service and they talk to the town of Cross Plains and they decide to go there and they leave us, let's say 5% of their population. Well, now they can do that. They don't have to wait to 2 years before the end of the agreement. They don't have to give us 2 years notice that they're going to do this. Boom, the next year, we could end up going from 60% to 80% of it. Now, I don't think that's fair. And not only that, as it was mentioned here earlier by some of the people from EMS, we can't absorb that in our budget. We would have to go to referendum. And it takes time to go to referendum. There's this uncertainty that is unfair to the village of Cross Plains. The towns have kept the ability to control parts of their decision-making. We don't have that. I have to wait for 2 years prior to the end of the agreement to even start the ball rolling, and then I have to wait 2 more years. End of the year, town of Cross Plains could say, we're going with West Middleton, village of West Middleton, we're out. Now, as long as they keep that 5% in there, or 1% or something, they're still part of our district. So let's just play this out. I don't think this would happen, but it is definitely could happen. Let's say town of Cross Plains sends everybody but 1% of their district to Middleton or West Middleton. Springfield sends everybody but 1% to Middleton to Wanakee. Town of Berry sends everybody but 1% to District 1. So that leaves them having 3%, us having 90%, 97%. We get 1 vote, they get 3 votes. How many people think that's fair? Right? Now, it's interesting because everybody's making this. Our district, what we're talking about, was formed because the village of Cross Plains at one time was part of District 1 and we broke away. And there was probably good reason for that. All right? So this is not necessarily new to the village. Now, when we talk about, so that's one. So then what we want to do is talk about what is the transparency, accountability, and oversight. Now, Mr. DeYoung in his, it's number 3, oversight and everything. He goes through his whole paragraph on all their state statutes and there's the medical examiner, and he's right. But that all covers the part that we're not talking about. That again is the operational part. What I'm talking about is the structure in the system. And this is not intended to blame anybody. It's just to point out what I'm talking about when I'm talking about accountability and transparency. So, to me, if you have a budget of $735,000 that's funded by the public, well, you should be able to easily find the budget. You should easily find the minutes, and not just the current minutes that are blogged out, but a history of the minutes. You should be able to find the employee handbook, so you know what they are. You should be able to find the code of conduct for employees. You should be able to find, if you have a complaint, where's the form? What's the process of that? You should be able to see what the policies that they're working under, the operational procedures. All of those should be easily found. I challenge you to try to find those, all right, right now. You're not going, it's going to be difficult. And then let's talk about accountability. And I've already mentioned some, but let's can you bring up the budget one?
Mhm.
All right. Go off one more slip. Keep going. All right, let me hold.
Good.
All right, yeah. So this is the budget, and what I'm pointing out is I've gone and researched this, so there isn't any criminal activity or anything like this, but it's something that is important that at least the budget is correct. So you all ended up getting the flyer here. And in the flyer, it mentions that the full-time staff and part-time staff didn't get paid overtime in 24. And I can't tell if they're actually talking about 24 and 25, but the heading is 25. But I can tell you right here is 25. And right here is also, these are overtime ones. And if you go to the 24 budget, you'll see there's costs. So one's got to wonder, right? If the employees don't know they got overtime, but yet in the budget is saying that we spent overtime, someone should check into that. Now, I think it's just an oversight in the material here, but the bottom line is where in the EMS district board do we have it where we would check into that? Can you go down one more? And then we go down, keep going to the bottom. Okay, that's good. So, wait, that's not the last page. Go to the last page. There we go. So let's take a look at this. The middle column, this column here is actual. If we would go back to the top, you don't have to, is actual. This column here is the actual budget that has been passed in November. And this is the percentage of what's been used. This one was given to us in the July 16th meeting. All right. So this is the one that you got to look at. All right. So if someone who reads this says, wow, you budgeted $165,000 for profit, that's a profit line. And generally that line should be zeros. Generally in the public sector, your revenues and your expenses should zero out. That's how it's done. So what this tells me, now I know it's wrong, all right? That tells me, wow, we ended up taxing people an extra $165,000, and we make up 60% of that, so that's 80,000 to 90,000 that shouldn't have been taxed. Because we don't tax people for a profit level. Now, this was just done wrong because they entered up on top, they put basically a big chunk of this is because they entered the surplus that they talked about into the current budget. And again, at the meeting when we had this surplus, I asked everybody to, hey, we should do budget amendment and all this, and they were happy with just a typed out sheet. And this is what happens when that's told. So again, this is what I'm talking about on accountability and transparency and stuff. I'm not talking about their operations and stuff. I am talking about what is needed to run and safeguard public monies. Just like we have this with any other agency that we have. All right, let's go to the next one. All right, so this is the other one that got everybody going. So this is basically illustrating that if a decision is made to go to a second crew, because of how the formula is done, and this is a low number, but if a crew costs 500,000, right, our portion is 300,000. If you go to a second crew, 500,000, our portion is 300,000. But the kicker is the village only needs one crew. So we're paying an extra $100,000, basically 20% more. And that is subsidizing the towns. Now, people were very upset, especially Mr. DeYoung. He wanted to say that there's no way we're then we need a second crew and all of this. And he's right. I agree. I'm guessing some of these agree. But that doesn't change the facts. The facts here, it doesn't matter if this happens in 1 year, in 5 years, in 10 years, in 20 years, in 30 years. This is going to happen, except for these numbers are going to be bigger unless we change the agreement. There needs to be a change that states that the village will not subsidize the towns. I think that's fair. I don't think that's unreasonable. So the point of this was just to illustrate that the formula that's used may work with how we are now, but anytime you double up on something, we are paying more because we've got that 60%. All right. So let's go to option one. This is the one that obviously has gotten everybody talking about. Now, I want to again emphasize option one is if the towns tell us to pound sand and they don't want to negotiate a new agreement. All right. That is they're certainly their right. But we have to be prepared if we want to really change the agreement. Our option, and there's a couple in the report, this is the one that everybody's talking about. The other option is contracting out, and it's pointed out Mr. DeYoung and certain people here, and EMS did a very good job. Some of the younger people who talked at the board meeting last came up with really good cons and why we don't want to contract out. And I'm 100%. I do not believe you should contract out emergency services. So we can put that aside, but if I can tell you, I've been approached where there are citizens that think we should go that route. But anyways, I'm not in favor of that. The other one is to join another district and, you know, there's been some talk about merging with Wanakee, Middleton, making a regional. That's not gonna happen by December 1st. So that's really not a realistic option. And then there's the option that we've heard that just keep everything the same. And that again, I cannot support. I will never support that because it's just not sustainable for the village of Cross Plains. So let's talk about this. So why option one? Now, what option one is basically the structure and the systems would be merged in. The operation, the building, everything else stays the same. The people stay the same. Really, for staff, the really only thing they would notice is their check will say from the village of Cross Plains and instead of iSolve or whoever third party. All right. So what this does, though, remember all those things that I talked about, that transparency, that automatically what happened. The chief would not have to worry about storing minutes and record keeping and all that. There's a system for that. It flows in. The budgets would all be handled through the finance department. We wouldn't be looking at that. There's HR services. Carly here would be able to support the chief and HR matters. There's legal. We meet with our attorney once a month. We have someone on, they know the village, it's right there. All right, there would be support. And that is really, really important. All right. Because if you look at the next one, the chief turnover, and it says 3 and 5 years, and that's generous. I mean, I could say 3 and 3 years if you really added up the months and everything, but even so, 3 and 5 months. So we've gone through. So the reason is, and I've talked to every chief that has been EMS. All right. The 2 that left were clear that the workload was overwhelming. One of the reasons that we are at a paid staff is exactly what one of those got tired of burning out. Right? The chief was putting way too many hours in because it was set up where if they couldn't fill a shift, the chief had to take it. So they couldn't take vacations. They couldn't do what they wanted to do because they were so overwhelmed with the hours that they go. Now, the current chief, she has made it very clear that this is her life. She doesn't mind, and maybe it has improved where she's not putting in tons of hours. But I know when I've met with her in the past that she has, and that's expected. But here's the other problem. We need our chiefs to fill hours. They need to be out on the ambulance and take shifts. Okay? So we need to hire chiefs that have that skill set. It is hard, almost impossible, to find someone who has that skill set, who has budget and finance skill set, has HR skill set, has legal skill set, has website development skills. It's crazy. It's crazy the amount of work that we put on our chief. And that is a systems problem, a structure problem. That is not an individual problem. I am not blaming any chief for having to put all these hours in. That is the district board's problem that needs to be solved. Okay, now, and that kind of covers that whole thing is the chief is a practitioner as well as an administrator. And it goes a little bit farther than just what we would call a chief administrator. It's actually more like Carly's job as an administrator. All right. So then we also had, and you all are aware of, we had our first chief ended up stealing funds from us. All right. And that was done as a crime of opportunity. it wasn't a complex system that she did. It was basically, she was in charge of payroll. She put in there that she could get overtime, that she cashed in sick time, she cashed in more vacation time than they want. I am telling you, if they were part of the village, that would not have happened. I don't even think she would have tried. But you have someone from the outside checking that on the inside. I am confident Bobby would have seen, what? The chief is cashing in 100 hours of overtime? They're not even eligible for overtime. That would have been, all right? So I think that is kind of why we are looking at this. So when we looked at that, those aspects of it, we also looked at what would happen if we did this and the towns did something. So the towns could, two things. One, they could come together with us and we could, yeah, I'm on that slide. We could come up with a new agreement. There would be no cost change at all. It would pretty much stay the same. We're changing system and structure. That's it. It could go where we go by our own and everybody decides to go with us, right? And use us as a contract service. That's a possibility. It depends on what metrics they want to use. If they're using calls for service, I mean, response time, it's a no-brainer, right? If you're looking at response time versus level of service, maybe you're willing to give up a minute or two on response time to get a paramedic. I don't know. That's their call. All right. That's their decision. Now, if all the towns leave us, then from finance, it will cost us $260,700. Now, Mr. DeYoung doesn't agree with that. What his statement is, with no data to support it, he says it's going to be 3 to 4 times the amount. So, okay, let's take a look at that. Back in his number one concern, remember that number I wanted you to remember? The $286,075, which he thinks is what we pay. So let's just do a little bit of simple math. If we go 3 times that, which he says it's going to cost us, that will come to $858,000. Now remember, the total budget is $735,000. So I'm trying to figure out, where is he thinking if we keep everything the same and we just take in the money that we would be getting from the towns, it would going to cost us $858,000, $225. And that's not even including that $150,000 to $160,000 we're going to bring in on user fee revenue. So let's go 4 times. 4 times puts it at basically $1.1 million. If you go 4 times 286.75, it comes to $1.1 million. Again, whoever contacted Mr. DeYoung, I would ask you to recall him and get us the numbers, how he's coming up, because that's significant. There's a huge difference in that dollar amount than what finance. And I'm confident with finance. You know, we have accountants on there, so I'm pretty confident that our numbers are correct, but I think it's important to bring that up. Now, there is a capital cost, because in the agreement, it says whoever pulls out has to buy out the other members. And in that report, we went through and found that, which was difficult. That was very difficult to find the numbers. But it turns out, we're pretty confident that we own 55% of the assets. And basically the big assets that we're talking about would be the building and the ambulance. All right. But the ambulance is a little different because we already own mostly, almost 60% of that. But the building, it's at 55%, plus they have to pay us 46,000 because we gave the land to the district with the understanding, if it sells, the village gets $46,000. So if the building goes for 500,000, easy math, we would end up having, our share would be 275,000. We'd have to pay the townships 225,000 minus the 46,000. So you're talking about 174,000 would be what we would need to pay off to get that. So it's basically 87,000 for each of the district. Springfield, by way, town of Springfield, never had to put any money into the building. Why, I don't know. It was only town of Cross Plains, town of Berry, and the village of Cross Plains. So, all right, let's go to the next slide. Thank you. So the other thing we had to look at is what impact is this going to be on our current staff, right? You can't take in a $735,000 department and not think that there's going to be extra work for people. So we broke it down, we had it break down, and it came to, we figured there's about 62.5 hours per month with a cost of about $3,500. Now, when you do this, it's important to get the hours and the dollar, but that doesn't convert to actual cost in dollars. For example, management support team. All right. Yes. The chief will have to budget time to go to the management team meeting where they meet with department heads and talk. There's records management involved, but once the system is built, our system's pretty slick. You just download it into the website. Everybody has access. It stays for years and years and years. We have someone with website. Once the website is designed, it's just a matter of her taking the time when EMS says we need this updated or that updated. Okay, so, and payroll's another thing. You know, there's an administrative cost to that, but things are pretty automated now. All right, but there is a cost in the legal and HR assistance. I don't think EMS will spend a lot of money on legal, but there's probably going to be issues that come up. So we got to account for some of it. It's not going to be a zero. So that's where we have it right now. So that's just so you understand, we've looked into that and we've made calculations. All right. This is kind of going to be kind of a catch-all page. So EMS at one of our meetings gave a presentation on what the direction they would like to go. They would like to move from a traditional EMS model to a community EMS model. And I'm not going to go into a lot of details of that. You can find it in the report because I copied it verbatim from the presentation into the report so people have access to it. But I have a little of experience in something that's similar to this. When I started as a cop with the Madison Police Department, we were probably 85% traditional, 15% community. Obviously, many people around here know that Chief Cooper was huge in the movement of moving police into community policing. So in my 38 years, that's focused a lot. When I retired, I would say the Madison Police Department is at 85% community policing, 15% traditional. Now, why I bring that up is because I have experience in this movement, and what I can tell you is it's definitely worth it, but it's extremely time consuming. Because what you're doing now is instead of staying in the building and waiting for the call, you're out in the community doing preventive care and community outreach. And again, you can go through and read their presentation in that. But to do that, you need to free up some time. And that's another reason why we want that. In my opinion, I will do whatever I can to promote that and encourage that we continue to do that. Now, what I'm going to do here for a few minutes is I'm going to take off my village president hat, and I'm going to put on my retired first responder hat. Because I have to say, since I have received a great deal of feedback over the last 6 weeks at public meetings from EMS, I would like to share a little feedback with them. And I think it's important for the safety, public safety committee. The first thing I want to talk about is there's a lot of mention about the loss of calls for service. People need to have calls for service, or we're not going to have volunteers. We're not going to have people wanting to work here. And I understand that. I clearly understand that. But what I think you have to be is a little sensitive, because that experience that you're wanting means that someone is experiencing a medical emergency. And I am pretty sure they're not happy about it. I'm sure their family and friends are not excited about it. So we got to remember that when you're getting that experience, it's at a cost. There's a cost there. And I think we need to appreciate that a little bit more and try to, while I have an understanding, and I think other people have an understanding, just try to remember that there's a cost to that experience that you're getting. And I think everybody in this room would love it if you never had to leave the station, that we didn't have any. But the reality is it's going to happen, and we want good people responding, and we have good people, and we have a good process for responding. Okay, that's why we didn't touch it. The other thing on there is the talk about why volunteers come. I believe most volunteers volunteer because they believe in what the agency or nonprofit does. I believe a lot of our volunteers volunteer for EMS because they want to serve their community. They are interested in medical care. And this is a way that they feel they can give back to the community. And many of us have that. You know, I strongly believe in volunteering, and I do a lot of volunteering. I would not volunteer for EMS because that is not my interest, and that doesn't match my skill set. So I want to say that I give these volunteers a lot more credit than saying, hey, they're coming here so they can go out on a call. I think it's bigger than that. I think it's much bigger than that. And there's a lot of reasons why people volunteer. Now, the last thing I'm going to say, and it's going to be more as probably a lecture on this, as a first responder. There's kind of a code and a principle for first responders, and that is the community comes first. It doesn't matter what the politicians do or the policymakers or your bosses, the management. There's this code that the community comes first. And there's a number of first responders that have taken that to the limit and have lost their lives doing that. They have been injured. They have seen things that people really shouldn't have to see. All right. So when I read the comment that if the village votes to take over and dismantle CPEMS as it currently is, then all this community engagement will disappear. And the first thing was showing all the engagement. You know, at first I was embarrassed that someone would actually, in that field, say that. Then I became kind of angry. That is not what first responders do. We do not use the community as a bargaining chip or use it to take away a service or to use it as blackmail. That to me is unacceptable. And what is also disappointing is that I would have hoped the leadership at EMS would have stood up and say, we denounce this. We are involved in the community. We want community EMS. We will be in the community. We will take care of doing preventive care for our citizens. That's what should have happened. All right. So I'm going to take my hat off again. I've said my piece, and I'm going to put my president's hat back on. So, in summary, what we have here and what I'm trying to achieve is really fairly simple in stating. It goes back to the two first slides. One, we are extremely happy, proud, and grateful for what EMS does on an operational level. We are not happy with the agreement. All right? So the goal is to change the agreement. And it'll be up to the board if we want to take it to the level of, if they choose not to go along, it'll be up to the board if they want to choose to take that step, the last step that we have to pull ourselves out of the district. So the agreement is now gone. And we can still join and do another, we can still become a district. We can join with others. I'm not opposed to that. I just cannot any longer, for the reasons I've said tonight, in good conscience, vote to maintain the current agreement. And again, I only get one vote, so there will be others, but I will certainly think that, and what we should be doing is all working together to work this out. But yet, I have not heard from any of the towns. All right? I've heard, quite frankly, from some of the citizens that actually agree. And I can tell you, I'm not the first president. I can tell you almost every president in the last probably 2 decades, and most trustees feel the same way. It needs to change. And we're at the point of either making the change or accepting it and waiting another 5 years to have this discussion again. So the last, well, I guess I did have one more slide. My fault. I apologize. I had my summary before my last slide. That's not good. All right. So we'll talk back to funding. So the current budget, again, there's options where we go out and all of them subcontract or we get an agreement. There'd be no change in the budget. Nothing would change. Increased service area, that could come down the road where maybe we hook up, maybe we go with the village of West Middleton, or maybe we talk with District 1, anything like that. But there's a way of bringing the cost down because the more people you have, the less of the cost, because it's based on population. We have a TID 3, many of you know, and we'll be meeting on that in the next couple of weeks. But last year, it looked real positive that we'd be able to close TID 3 next year. And I don't want to go into a lot of details how they work, but basically when you close it, there's an influx of funding from the assessments that we're paying for the TID. And last year, It was around 300,000. All right? The other is an option, hey, let the community decide. Let's go to referendum to cover the cost and just see what the people think, the Village of Cross Plains people think. We're representatives, but this is one of those, I'm not a big fan of referendums. But I think this is one that may make sense to do. So, of course, I'm not gonna go into a great deal, but those are pretty much a summary. When I do this to the board, they'll have many more details on each one of these. All right, now we're at the last slide. So, any questions from the Public Safety Committee?
Yes, the chief might consider one of the committee members.
I guess the one question I have is the other townships have just closed any opening to this, they've not even responded to this discussion.
No, and I think the chief I get either, hey, that's your problem, not mine. And when we did the proposal in February, I will say two of the townships just flatly said no. The town of Barry invited me to their meeting and we had a really good discussion. And it kind of was, no, we won't do that, but if it happens, we understand. No counters. And it was, and there's other models out there. I mean, you could go to, which is interesting, I'm hearing people say they're gonna go to the Middleton district. Well, if you look at our proposal and you look at how the Middleton district works, I'm gonna be honest, I pretty much copied that. It's not like, it's the Middleton, pretty much a Middleton model. I gave more power to the district than what Middleton does. But there's other models. Like I say, I am open, to different ideas. But to just keep it the same, just doesn't work. Yes.
Actually, kind of two. One, the slide that you showed that comparing apples to apples, the fire versus EMS.
Yeah.
And how much the EMS has gone up and the fire has not.
What is the percentage? That one?
I guess my thought is, maybe I'm reading too much into it, is this where the community EMS model would bring that number down?
I
guess my question is that really apples to apples? When you're thinking about what has all happened in this world in that amount of time, and how many more calls you have that might be more mental health related versus.
Well, no,
I was just wondering about
the
that.
only reason I'm using apples to apples is because Mr. DeYoung, that's what he wants to do. And you heard one of the speakers say a comparable would be the fire department. So I'm just following what they are. There's a big difference. The biggest difference here is the fire department is volunteer. EMS is paid with volunteers. And there's not a savings to that because we're not looking at changing the budget process or the budget. We're looking at the structure in the system. That's what's trying to change. Now, you're right, by having the structure, it dictates some of the costs, no doubt about it. But I'm not looking to change where we go in and examine where the savings. The community EMS is more of a philosophy change. You're not going to lower the number of staff because you have the 24/7 coverage no matter what, right? We have to do that. That's the beginning of staffing. You look at what is needed for coverage, and we need that. But what it does, hopefully, in my opinion, if they focus on preventive care, just like we do with problem solving in policing, it actually reduces the calls. Because let's just say for an example, let's say there's an individual that needs to take insulin. And they're just not very good at remembering to do it. And it becomes medical emergency, right? We respond and stuff. So how you would solve that is you would try to find maybe a family member or someone that would call them to remind them to do it, or stop by, or a neighbor would come over. That's what we're talking about, community, where you actually get in and try to prevent emergencies.
I mean, exactly,
Yeah.
and I don't think that, yeah, fire really can't do that.
No, you're right. If you're looking at job descriptions, there's no comparison except for another EMS service, right?
But my other question.
Sure.
Was this, when grappling with this in my head for all these couple of weeks, being the safety committee, how much should we really be thinking about the finance part of it? Are we not really just supposed to be thinking about the safety part?
Well, I was gonna, when we got past questions and into, I was gonna try to get, especially at 8:40, I was gonna try to guide to like, maybe it would be best use of our time to focus on the safety aspects, the policies, that kind of stuff. And we have the finance committee, we have the village board. I think they're gonna, tackle the numbers, and you would probably be better in this group.
But I do have, I'd like to see a slide where we got to the bottom of budget. Where we were showing,
That would be the
yeah,
25 budget, yep.
Okay.
that is the official budget document.
That is the one that was received on July 16th, I believe our meeting was.
Yeah, final, I was.
Well,
asking-
the final, see, this is what, so the final budget gets approved in December, right? Or in this case, we do it earlier in October or something. That's the final budget. That goes out. But during the year, and I'll tell you where this came. So once the audit was done and the year was ended and they closed the books for 2024, there was money left over. All right. So you have this, they had this $132,000. So the chief came up with different ways of doing it. Now, where to spend the money, right? If you go to the top of the page. So where, again, unless you do budgets, you probably are not aware, she ended up. No, is this the top? No, you gotta go to revenue.
You want page 1?
Yep, page 1, revenue. Okay. So if you look, you see this carry forward? This right here, this number? This would have been okay if all of this money would have been spent in the expense side of this budget. But some of that money went into savings and checking. So this number should have only represented what they were actually going to spend in the expense side. Because that bottom line, and I, like I say, I don't, again, I made how I thought it should be done. But anyways, all the budgets are little, they should zero out, but even with, if you want to know the original one, instead of 165, I think if you go back to the original, it had like $4,000 in the profit. And again, it should always be, in public budgeting, it should always zero out. Now you have surplus, right? Because this column, you carry the surplus in, and this one will tell you the percent. But this one should stay steady unless you do budget amendments, and budget amendments is you put in the revenue and then you put in the matching expense, and you always stay at 0. Now that accounts for some of this. I would have to go through a lot of the other lines to really figure out how we got to 165,000, but I know we put some, this is obviously a big chunk of it right here. That answers your question.
Question.
Go ahead, Kevin.
On that percent of levy, I know I don't wanna talk budgeting more than anyone else, but I would find it helpful if we had EMS, fire, and police on one slide for percent of
Well-
levy, and I'm not sure.
Well, I think the
Wait.
problem is police. You know, they're already the village, right? So like, you know, I guess you could look at it, but that doesn't reconcile the issue Jay is talking about, which is you have that district, right? And the district representation and voting and all that. But that problem doesn't, this with police.
Right,
Village-
see-
Village board
Yeah.
completely controls their budget.
It's,
I get it.
It's a non.
Right.
Yeah,
So even, it doesn't, if they're 100% of the levy, which I mean, they're not, they're, you know, like, it doesn't really matter because the village could control that directly. without-
yeah, and that's what Mr. DeYoung was talking about. There's,
Yeah.
there's a difference. So you could do that, but the difference, the significant difference is that is a village budget that falls in with the rest of the budget process. These are budget items that the village board does not control. That's the key difference.
Yeah, my point's on trend.
Is what?
My point's on trend. Is that trend gonna remain consistent, or is that trend gonna look similar to EMS, is it performing the
So-
same
No,
budget?
I can
When
speak
it's
to
the
this
village?
a little bit. So there's like I don't know the reason, but there is like a macro, it's like a bigger thing than just like the village or Dayton County. But Jay had talked about Marshall, right? They had gone through a similar process a few years ago. They ended up choosing, I believe, to join
Sun Prairie
Sun Prairie's.
for contract. with
Or,
them.
yeah, I'm sorry, contract with Sun Prairie is what they went with. But they were in the same spot we're in right now, and I don't know why this is, but for some reason, it's easier to find fire volunteers than it is for EMS volunteers. And again, that's not speaking to like a specific like Village of Cross Plains or Dane County, like that just seems to be something across the board.
What?
When you get to be a village our size or a community our size, like that,
No.
that's the first.
It's all, here's the biggest problem with EMS. And you can, and it came up at my meeting with Town of Berry, with their chair. To get to where they are, they gotta put in 240 hours of training. That is a boatload of training, right? That is a lot of training to then just do volunteer work. So that is, I think, and it's becoming more and more with fire. Now, fire, I don't know, that's what, 40, 80 or something like that, I'm not sure with it, but it's less than 240. All right, now what has happened, if you go up north, because I talked with someone from up north. There's, I think it's Mercy Hospital that does subcontracting for almost all the villages and townships up north. Because again, what Cameron has said, it is difficult to find volunteers. Kudos to them that they have 28 volunteers, and they have been very smart in hooking into the schools to get volunteers as part of their schooling. That's a great move.
So I guess that's just to say the fire has not, they're still volunteer, right?
Yeah,
But
Well,
one day,
I get fired.
and I don't know when it will be, I'm just speaking because I'm also on the fire board, so we had kind of similar conversation about a year ago. Right, but hey, someday they're gonna be in the same spot where the resources they need to provide services are not gonna be there with the volunteers, is they're just gonna need too many, and, you know, it's gonna be more, you know, and eventually they're gonna get to a place where they go to pay. And when that happens, we are likely to be having the same exact conversation. You know,
I don't know that. Yeah, I can address that offline.
Now, you can, you know, it's pretty easy to do.
Yeah, I
You
can-
can go to our budget
Yeah.
online and see what we pay for police, and you can see what our levy limit number is and just divide it out.
but then you already you had that number, right?
No, I didn't have it for police.
Oh, not the percentage.
You
right?
had that.
Yeah, I have the raw data. Yeah. I didn't multiply it into,
And that,
because that wasn't my point of putting police in there. It was just to demonstrate
well, they're
a
three,
size of budget.
and they're three different models.
Absolutely.
That's, and if this model is more moving somewhat toward that minus the volunteers paid positions, then that's what I'm starting to equate it to.
Oh, I see what you're saying.
So I think it's relevant, in my opinion.
Mhm.
And if fire gets there, trend and the benchmark's already there. So, Jay, I know you mentioned it was the district, right? The district is made up of four. Sounds like some outreach has happened,
District board, yep.
for district board of the
Mhm.
four representatives, right?
Mm-hmm.
Not questioning the process as much as it's hard to reconcile in my head why that group would come together, and if there's some third-party mediation that should be taking place or considered there to bring the four representatives together versus say you versus say one of them, and what that district would, how they would receive that. Right.
Well, you got everybody excited because that's what I have heard so many times. Mediation, mediation, because in the contract, it talks about mediation. But I'm trying, and this is good that you brought it up. I thank you for doing that. So let me just kind of, and you will know this, in mediation, when it's built into an agreement, kind of like within a contract. The mediation is when parties disagree with something within the agreement. So let's, I'll give you an example to show what would be and what. So in the agreement, it says population is what determines the percentage. So let's say the village board has a formula and it comes up to this. And the village has a formula that comes up to this, and we can't agree, they're different. That is something you bring to mediation. And the mediator will look at the contract or the agreement, and it'll say population, all right, both meet that standard. So then they'll look and hear arguments from each side and try to get you together. So that works, right? Now, let's use the same thing. We're talking about figuring out who pays what. And the board does population. And the village says, no, we don't want population. We want equalized value. All right. So there's a conflict there, right, in determining it. But when you go to mediation on that, the first thing they're going to do is look at the agreement. And the agreement is going to say population. They don't have the power, nor the two people that are talking, to change an agreement or a contract. Now, if Kevin is saying, hey, let's get all four of us in a room and hash this out and see if we can come up with what everybody agrees to change the agreement, absolutely. But with EMS, they keep wanting me, if I don't like that the vote is one vote for Cross Plains and one for each district, I should go to mediation. Well, I know what the end result's gonna be. The mediator is gonna say, no, the agreement says you get one vote. It's just not, that's not what it's meant for. The mediation in that agreement is for when there's a difference in agreement. Now, where it could come in, and one of the other members brought it up, when we decide the value, let's say, of the station. They could come up with one value, we come up with another, we don't agree, we go to mediation, and we come up with an agreement on what it costs. That's what that in the agreement is talking
So
about.
just to clarify, my recommendation was this would be with four representatives. And someone would moderate and facilitate a discussion with only those four.
I would have no problem with that.
No different than a shared
Mhm.
service for any other business or
Yep.
contract. Those paying into a shared service, there has to be some facilitated discussion about roles and responsibilities, let alone cost sharing.
Absolutely, I agree 100%. Now, what has to be, who you have to convince are the town. You know, there isn't a huge incentive for them. Right?
Right.
I mean,
Well, there is if number one goes forward and.
oh, if we, yeah,
So there is, and if that's the way there's leaning, I would want, I know.
Oh,
the
yeah.
village would want those same three districts or same three municipalities,
sure.
townships as part of the village district.
Yeah, like I say,
Okay, so,
I'm not opposed, again, my focus is the agreement.
Yeah.
That's it.
Your focus being the agreement. It just also seems what you're saying, and maybe I'm not getting what you're saying, is that you don't see how it can be changed.
No, I easily think, for example, we went through it, the blank check. To me, I have a problem with anybody having a blank check, especially since the village is paying 60% of it. I don't think there should be a blank check. My solution is put a cap. Put a cap on it. If it goes over that cap, you gotta go to the municipality's board. There's an easy solution. I got that fixed just like that.
But getting everybody to agree on that is what I'm saying. What I'm hearing from you is that you don't think that that would ever.
Well, no, here's the thing. I've tried. All right. I have tried numerous times. The village has tried, and we just haven't had a response. Maybe we will. I would love if EMS, why doesn't EMS go to those board meetings and say, hey, why don't you go talk with the village and let's get this worked out? It's wasting a lot of our time and giving us stress and frustration. Let's get it worked out so we can go on to our business. I would love that. I am not turning anything. If anything, I have been the one to keep trying and trying. This is 2 years now I've been working on this. This isn't something I just popped up with. It's been working and I can show, right? So I'm open. I've always been open. I just want something that is reasonable for the village and it's not going to harm us financially. And, again, I just believe a lot of the big decisions should be done by the boards. So absolutely, I'm open to all of that.
I mean, maybe that's worth a little discussion again, trying to stay, I don't know, we can stay away from budget a little bit. I know there's a lot of ifs here, but, I think if you look at option one, that case scenario, and we can also talk about the worst case, but I think it's worth us discussing, right? I think the best case scenario is if option one is chosen, and I'm not saying it's just, we're not gonna be able to have productive conversations, lay out the pros and cons of all things. So, is EMS as it is in the district, take all of the employees, everything, chain of command, policies, procedures. All you do is we put them under Carly. Right, and now just like police, there's a Village of Cross Plains EMS department. Okay? They have a budget, village board, controls that budget just like we do with police. That's the rosy, again, everything goes right all the time. And we got, if you want to talk about financials, assume the towns stay. So then there's no really budget change. Really, the towns, and again, we're not representing them here, but the towns would just pay the village for the service instead of there being, the district and stuff, that with the policy. What are people's thoughts on that? We can talk about how that would go sideways, but that's just the thing. Like from a public safety standpoint. Concerns with that? Questions?
Well, I'm gonna make a comment, but for everybody here, I want you to be clear about where I'm. Because I'm not a bean counter. I was one of those early EMTs, became an EMT in 1981, college. Licensed when I was in the police academy. I was licensed with Middleton, Claris, Greene County, Shorewood, Maple Bluff, so I'm an EMS guy, law enforcement guy, tax. The last 3 years of my police career was public safety. So I was command of fire EMS district. When I took the job, they said, by the way, we're building a building, EMS district is falling apart here. Good luck, we're all behind you. So I get where everybody's come. I get it. I've used EMS. I have a great appreciation for local service. I don't want that to change. And I don't think anyone on this committee, I haven't seen any shows me that we're not going to be able to provide outstanding service to the people. But change is coming. I saw it 20 years ago. And so we're morphing away from volunteerism into paid service. And that doesn't mean we're going to diminish the service. It means we are look, I don't want a contract, though. I don't want some, I want Cross Plains investment in my house, just like I want the police department, not the sheriff or the fire department, whatever it is. But this change is coming and we need to get out of it. And I think it's ridiculous for these townships to take this position where we don't have to do. Because I'm putting all the money aside, even though I'm having a heart attack about that financial state. I've never seen it like that. They should be thinking first about people that live with us. While providing service, not, oh, we'll just, whatever. All we're asking for is to negotiate a new contract that's better for everybody, fair for everybody. That's not about cutting service, reducing anything, changing anything. It's just, everything has to be looked at. And at the end, everybody will probably come out ahead because the service will be great, we'll move on. And we're gonna be converting to paid service on fire, and that's just gonna happen. That's just like, people are too busy, there's too many demands on their life, and making the commitment, God bless you for what you do. But it's all changed. And so I am not in support of contracting. I'm not in support of losing service. This is Cross Plains. I don't want to become Middleton. I don't want to become Madison. I grew up in my home school, so this is my home. But I think these town boards really need to be real about the fact that they need motion. We just gotta sit down and talk about it and lay it out. What's fair is fair. That's really. I don't want to talk about the money, but this is all about safety. This is about providing service. And I think they're being short-sighted because they're not recognizing the future. And that's all we're doing is looking at the future and ready. That's what we gotta get to.
Anyone else have any comments on the rosy, perfect option ones?
Is the option one rosy and perfect?
No, I'm saying,
Right.
if option one is chosen, I think what I described is like the absolute best scenario though.
Is there any way to merge 1 and 4? And in my mind, public employee, myself, maybe this is, I don't have a good handle on that finance part of it. But
Okay, I was just saying, sit down.
the district stays, but take that piece, the budgeting piece that town has to deal with, and then either the village person does it or one of the town treasurers, that they take that on, and the rest of the district then gives money to that one to help do that.
That was actually the proposal that we did 18 months ago. It was payroll and the budgeting.
And they,
Well, the details are a little fuzzy, but we, the village board.
Yeah.
Talked about that, but all we can do is we voted to, move that as an official recommendation. It went to the board, the district, meeting that district board.
get back to what Randy was saying, just get everybody to sit down or kind of the same thing.
Right, yes. So I think if you wanted to combine 1 and 4, right? I guess the people at this table, our power is very limited. Aside from, I think, doing what we're doing right now, we can't take any official offense, but having discussion about like that as an option on the table, but ultimately this group doesn't have influence on the district aside from asking.
So there's a couple of things that I'm thinking of. All things being option, whether it's option 1 or option 4, what are we compromising with a financial shift?
Can I just interrupt here for a second?
Yeah.
The finance report that you're talking about, option 1 and 4.
Yeah.
That's only applies if we leave the district.
Yep.
So you see what I'm saying? So if the district stays together, those never play a role. I just want to make sure everybody understands. If you remember my slide, it was change or so I appreciate you talking about option 1, but really there is the option that seems that people want is let's get the 4 groups together. Then option 1 through 4 doesn't apply.
Yeah.
I just want to make sure
Yeah,
that that's
let me
clear.
rephrase that then. Do nothing. Right, do nothing to renew an evergreen contract or an agreement, which is what something we did once. If you don't touch the agreement at all, or if you move to another option, which is, whether it's the village or any of those 4 options. Public safety, I'm concerned about outcomes in terms of health. And are those outcomes being compromised by moving? So that's where I'm
The health,
focused.
help me understand that.
Well, EMS is here to serve our.
Right, right. But none of those options change the service model.
Yeah, yeah. And
So
I
you're
guess-
gonna get it the same.
Well, and that's where, appreciate your perspective, Jay, but I would love to hear and know more about what are the pros and cons, because.
Wow, you should have been coming to some.
Well,
I mean,
yeah,
to piggyback, I think that's the biggest thing is. Jay, you're saying like they're, in the beginning, like your first slide was like, none of these things, we didn't discuss these things and these things aren't changing.
Right,
Like,
because,
that was your, that
yep,
was the first slide, but.
yep.
But we've heard that those things would change.
But yet you hear that, but there's no examples. There's no examples. You know, you heard one say that the response time is gonna be longer. Well, we're not moving the station, right? Now, where they're coming from is what they talked about, the towns. If the towns choose to go to Middleton and not Cross Plains, then absolutely response times are gonna change. But if everybody stays, none of that stuff changes. There's no impact on the people or the service model. And the reason we did that is because everything's working smooth. So why would we look at that? That's not where the emphasis is. The emphasis and the only thing we're trying to change is structure and system. That is it. Even the dollars we're not even talking about. Nowhere in the report, nowhere have I ever said that the 735,000 is unreasonable or not justified. None of that is. That's all there. We are just talking about the agreement.
But we still need those other.
Absolutely.
personalities to
You
stay.
do.
It's a huge,
Yes.
you know, it's,
Yes.
it's not gonna change if everyone stays, but that's the issue is. We
Well,
don't know, no one's going, you know, we haven't gotten the other 3 to hang on, to
right.
stay, right?
And I think that's part of what we're,
That's
trying
what we're
to-
discussing now.
Yeah, so we're trying to get that discussion started, but I mean, the other thing, if you look at this, like, it's like a lawyer, right, there's the agreement, the only thing, with the contract that we could do to really force any discussion is to give that notice on December 1st, or before December 1st, etc. So I mean, but like, we don't want, we're not there yet, but that's, again, why we're trying to have the discussion to get that kind of combo, well, I guess it's not really a combo of option 1 and 4, but one of the options that, I guess what we're going to call it 5, is the district agreement is rewritten to a place where the village and towns are happy, in particular with the financial differences. Is that fair, Jay?
It is, and that's where I think this thing came off the rails, is the finance committee was only in charge of looking at options if we left the district. They weren't talking about staying in and an agreement, none of that. And that's where things got kind of where option 1 became the talk of the town, because EMS was monitoring that. So they assumed that because finance is looking at that, that's the motive behind doing this. When really the motive is to change the agreement. But we have to be prepared. What happens if they don't change the agreements? What are our options? And that's what finance looked at. Those were the options.
Because if the 3 others don't want to play, we have to prepare,
We have a decision to make.
move forward.
We have
advisors.
Yeah, we have legal obligation, right? Hence that 2-year
And that's
thing, right?
this committee. That's it.
Forgive what Jay said, there is that 2-year window, but any of the towns during that 2 years, you could take 95% of their capacity somewhere else.
They can. They have that flexibility. There's no time limits or requirements.
Let me try to paint at least what I thought of I guess trying to get back to just, I mean, I know option one isn't in anyone's favor right now, but I think, again, trying to just have a productive conversation on some of the pros and cons. I think the darkest side of number one that I have thought of, and I've been getting emails from EMS folks, Holly, so I've been digesting a lot of info, well, more than you guys over the last couple months probably. But the darker side of one, so let's just say, again, not using that or recommending, but just for a discussion point. EMS, we still take over, we form an EMS department. I think one dark side would be none of the staff decide to come, right? So then all of a sudden we have to go hire brand new faces. That's obviously not good. You know, go for training, who's gonna do that? That's not good. I mean, I don't think this would happen, but like now all of a sudden, instead of the district being in charge of the policies of the EMS, you'd have the village board. So, you know, would the village board, you know, set some crazy policies like it'd say, oh, we do not support community EMS. We want, you know, because the board could do that, right? And then EMS as a department of the village of Cross Plains would have to abide. That's, and I guess from the financial dark side, none of the towns join us. They all go do something else. And then there's also a huge budget gap that would probably ultimately land at layoffs. Because we wouldn't need as much staff in the EMS department just to cover the village of Cross Plains. Not.
No, can I just interrupt?
Sure.
That's not correct. Can you pull up, let me just show you something that. There should be something there on staffing.
In here?
Yeah, on my thumb drive.
Oh,
Oh, you don't have that?
I have it.
Just,
What is
is there something that says? Coverage, put coverage there. So when I was with the Madison Police Department, I was on the staffing committee for 5 years. And the first thing you do is start coverage, and this will help you understand it. So they run a 24/7 service. So you take 365 days times 24 equals 8,760. Our crews are 2 people. So you put 2 times that, 17,500 hours. It doesn't matter how many calls they get, how big of the area, who you're covering, that's the coverage of a crew. So then you gotta look, okay, where are we at with staffing? So you take the 48 times 50. That is basically our full-time staff works 48 hours. I use 50 instead of 52 weeks because they gotta have time off for vacation, sick time, training. So that's really a very, very liberal. It's probably less than 50, but anyways, you multiply that times, gives you the 2,400 times 4, because we have 4 full. So you got 9,600 hours covered by full-time staff. And then what we have is they have a minimum of 12 hours for part-timers have to put in a month. So that's 12 hours times 12 is 144 times 18. There's 18 part-times. Now where I got that is in the flyer, it says they have 50 members, 28 are volunteers. We know 4 are full-time, that's 32. 32 minus 50 is 18. So that's where the 18 came from. So then you look, and this is what I was mentioning earlier, your volunteers, they're required to put 12 hours in. So 12 hours times 12 months is 144. There's 28 of them. So that's 4,032 hours they're putting in. So you put that together, it basically covers 16,224. That's your starting point. So even if we lose bodies and stuff, you're still gonna need all of that
Okay.
to cover. Now, the extra 1,300 can be made up with part-timers working more than 12 hours a month or volunteers. But that's your starting point when you talk about coverage and scheduling. Unless I've got something, is it still 48?
No, it's not 12 hours either. It's a minimum of 24 right now for our volunteers.
Oh, okay.
And our new structure, we're adding a bit more of an hours requirement for our part-timers in a career development track.
Okay.
The one thing that I will mention with this, what you're not seeing, you can see the number 2 up there. That is the bare minimum, 1A, 1B.
Right.
That's it.
Yeah.
We do not run that right now. We have usually 3, if not 4. For safety. And when you start throwing stuff like that and you say there's not gonna be a reduction in quality of service, that is an issue. Because we have 3 people generally on the rig.
Well, all that would do is increase the number of hours needed. I'm not sure how that translates into service when we're looking at coverage hours.
If you're looking at.
I take back my last point where I said about the darkest thing. I think Jay's corrected the last point. If the towns don't stick, we still have to have the same manpower. Regardless, for that 24/7 coverage.
Whatever it is.
So we'll stick with that, and the negative on, so there would be no layoffs, yes. So the negative side would be, it'll just has to pay, right, that there is now, and I don't know the exact number, Jay did say 260 in his thing. So we would just have to, find a way to pay for that. So, I'm sorry, I think out of the.
No,
other
it's very
things, that was-
complicated. It's
that
not.
was probably the only thing that I was majorly whiffed on. The dark side of number 1.
Nice,
Yeah.
side question. Looking at going 20% of the police. Is there any benefit to village taking on the EMS? I mean, is there such a position of somebody who is hard police, hard EMS? Does that make sense? I mean, is that a way of getting the police 24/7?
So that's been done, that's been done and not successful, not all the time, so I'll give you my experience. So city of Darlington had police, both 24-hour coverage. Scheduling structure was a little different, but every member of the police department was required to be an EMS member. That worked to some degree, but maintaining the certification. So for example, the training section of that is a lot even more expensive than the police section of training. So, and then you had to hire people that wanted to do that. And one of the big comments that Jay just made is, or made during his presentation, is that not everybody has that skill set or that want to do. So our department, being that I was one of the leads, we had to hire people that wanted to do that. It didn't sustain itself, like Randy said, and ultimately, the city of Darlington did take over their EMS because of the same things that were happening here. The cost was going through the roof. We couldn't get volunteers. They were contracting services. There was all kinds of things. Ultimately, now that city does not have EMS, they sold that to their hospital. So they made it stronger, and it took about a year, year and a half, and they did have people walk out. There was people that quit, a lot based on emotion, and it ended up working out. I mean, I think Randy hit it on the head. It's inevitable change. It's inevitable. You can't find people that want to volunteer in any capacity. We have it in the Lions Club all the time. You can't find people that volunteer their time. And ultimately, paid services is where it's going to go. We have to provide the coverage. So ultimately, that's where it's, at least my experience has led to. Well, I hope that answered your question.
I mean, and I guess another thing is, I know this was very concerned about 24-hour police coverage, right? So that's a risk here. Again, not saying we're going with option 1, but if that happened and you guys at the dark side where all the towns abandoned us, there's a whole bunch of funding that now is sucked up that is only going to prolong adding police officers. Unless you went to referendum, which again, Jake said he doesn't, like, and, you know, I think that would be tough with residents, but that would be the thing, you could do some sort of referendum that covers public safety, that gets you maybe, you know, the delta for EMS and then also some police officers, but I don't know, that's pretty extreme. Okay. I think in the Jay kind of said this, he doesn't support option 2 and 3 in the finance the thing, which, again, trying to stay away from finance, but I guess even from a public safety standpoint, I think we can kind of shorten this. I don't want to speak for this group, so someone yell at me if I'm not, or if I'm speaking, you don't agree with me. I don't think we would ever recommend contracting with the city of Middleton or another district.
No.
That's off.
Okay,
No.
I'm there too, you know, as this chairperson and as a board. Then option 3 is contracting with private, so Brian brought up. Okay, I am also there from a safety standpoint, so I think we can just skip those. We would never, ever, when we get to an official decision, which is not tonight, recommend those. Okay, agreed. So option 4, keeping things the way they are. Again, I'm gonna try to do the rosy thing, super gross. The best case scenario, I think, is, you know, the biggest concern right now is finances. So we figure that out. The district figures it out. It's not the district. This body has no power. The district comes up with something that is amenable to the village board financially and all the towns financially. Everything stays the same. I think that's probably the best case scenario with that. I don't even know if there's a safety topic to talk about there, because that just means everything stays the same, right? From a thing. So the dark side, and I guess, and this is all financial, but the dark side is that the village continues to have a, you know, the public check piece and all that stuff. So, you know, we are at the behest of that district, and their 3 votes, more or less, is kind of where things are with the current agreement with no changes. We have to fund it. So there's that has implications on adding police officers for 24 coverage, right? You know, with limited control there, there's going to be possibly more expenses. I don't really think there's not really a dark side services standpoint, because nothing will change that. I mean, most of the issues right now is financial, and that, I guess one other thing would be is if this body really wanted the EMS to do something from a policy. Again, the only thing we have with the district at the moment is we can ask nicely. I do think there's a little bit more power if the relationship were with the village board, right? Like, because we are a committee for the village board, so we would have more weight if this group said, look, EMS needs to do something differently for the betterment of the community, blah, 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 it's X. There's more, you know, that, yeah.
Am I allowed to make a comment?
I don't think so right now, because we're trying to, that's already late.
I do want to throw one other thing. As we move to a paid service, we have paid public employees. I think this kind of falls into public safety. We also have to be accountable. So employees have to be accountable in a system of supervision, regulations, HR, and all these other things. Because this is where lawsuits can come from. This is where, you know, we saw it out there where things can go wrong. And there has to be structure to it. And I think that's all part of this future too. Is that not by taking over, by having people be supervised, paid people being supervised, they're going to be better taken care of, be better supervised, better off. But also, things can't come up and say, where's money go? Where's this? Where's that? Why is this? You have to be accountable to people.
They have accountability right now with the district, right? And you know, that staff and stuff there. But I guess maybe to your point, there's no accountability with this group or the village board. Let's say something terrible happens, right? I mean, we wouldn't be able to, I mean, again, except ask nicely that maybe there's policy changes to prevent that terrible thing from happening again. But that, you know, that's kind of the extent of our accountability.
Right,
the
and
current
not
district structure.
to sound like that guy, but when things go bad, who's got the biggest check? It's the one that everybody's gonna go after. So if there's lawsuits, things like this.
And our lawyer's gonna point at the district, that, you know,
Right.
it's like, oh, no, don't sue us.
It comes back, let us just do the right thing, but the future, sure.
Right,
Yeah, you know, again, it's hard because people are here, people, we know each other, and we respect each other, and that has nothing to do with thinking though about the community as a whole. And when I think about the consistency around accountability, mentioned transparency, when there's changes in any type of leadership, especially when it's a paid service, let alone when it's, you know, even within the village, you worry about interruption. And that interruption and inconsistency that can lead to performance and compromising what I go back to as outcomes for public safety. So it's a relevant conversation, even though no one wants to have it. You have to have it. Stepping back, being objective as a taxpayer, let alone just as community interest, and goes for EMS, police, or fire. That's regardless of which public safety that is. So there is, when I think about the conversation we're having here, is we do need to, as a public safety committee, think about whether it's in the agreements or other those types of situations to make sure that there's not a compromise in service. Nobody's wanting to compromise it from an EMS side, of course not. But we have the not just fiduciary, we have to be accountable to our to the residents here at Cross Plains. And that's the village board, and that's of course public safety group of volunteers that we are, just trying to be the ones to speak up in a governed format like this. So I'm just bringing that up because it's a shared service that we're paying for, either through tax dollars or to a third party. Same accountability should be there from the village board or from taxpayers in terms of kind of that due diligence that we have to do. And again, it's not pointed at any one person or any one group. It wouldn't matter the group, and again, it could be a utilities company. You have that dependency to be an agreement that you need to feel good about covering all situations. So this process to me is a must. It hurts and stings, it's bringing up what I need to understand, at least from my personal side, is if the district holds together, if it was the recommendation from the village board to move and to move those services within the village, from a public safety perspective, I need to hear loud and clear, and we all have to get some type of agreement. What are we compromising from a health and safety perspective, and what are we not? Those are facts. They're not, I don't think there's a lot of squish there, and there's not a lot of room for interpretation. To me, that should be pretty quantitative versus qualitative discussion. And I'm not sure, I haven't been to some of those other ones, JD, or point. At some point, it's pros and cons, and we have to agree to disagree, or we have to disagree, but then we have to agree to move forward. And right now, I don't see that agreement. I didn't hear it here, and it's pretty tough to make a recommendation that we can feel comfortable with if there's not some type of discussion that's going to yield something that actually makes sense, because very contradictory statements were being made today. That's not healthy we're spending 3 hours into this almost, and a lot of time being put, and if we're not there, the rest of the community has no idea what causing money. That concerns me of our services, whether they're within the village or they're contracted outside the village. There's a, perception now of, that's very polarized. And that's concerning. So we're discussing, we're not voting. Correct. That's our role. And,
Well, just to be clear, it's early, I think, in the discussion. I mean, November, December is gonna come up really quickly, given where we are, but it's not like this group is not gonna talk about this again.
Right.
Right? There's gonna be more public discourse, there's gonna be more information. We'll likely get some, harder information, firmer information from the other towns in the district. And this will come back to this group before November. Probably with something a little bit more this or that, pros and cons, but right now it's early. This is, and to your point, there's a lot of polarization right now. And it was, I think what Chief Tony kind of said, what he said at the top, and I kind of tried to do it too, like, we want to have productive conversations. And I think we're doing so. Just a result. And
I just need to get to fact check here.
Right,
because,
yeah.
If money's aside.
Yep.
Then it's just fact check on what, and I need to get comfortable on that because I'm not right now.
I'm there too.
Agreed. I thought I was gonna. I thought I came in here thinking one way, and now I'm just kind of like, oh,
Yeah.
no, it's something like Kevin's like, kind of just need to obviously talk about it more and get more information and facts.
Oh, we need to be prepared to move forward because this isn't.
Right, like we can't sit on it forever. Yeah.
And even if, let's say, don't change the agreement, everything, we don't make a decision, December 1st comes and goes. I mean, if that happens and there's no changes, we're going to be talking about it next week.
Yeah.
So it's going to continue to get discussed until there's a change somewhere.
Right.
But, let's all be clear. I think this agreement, the current contract is a problem. There's problems. We need that needs to be told. That's gotta be.
Yeah, the agreement with a different staffing model and the times change quickly and
A lot's
you have to review the agreements. Again, regardless of who that's with, what that's for, you have to review agreements, and that's just standard procedure for any outsourcing.
And I think there's a lot of liabilities. Well, for some things. It's not good.
I don't know if this perspective helps, but we did have this kind of discourse at the fire board level last year. This time to sign. We can sign it for another 5 years. And we went through this kind of same thing. We looked at all the numbers, the village, and that one set up different because it's 3 village people. So it's Jay, myself, and Sarah. So, us and then the other districts also had 3 people, but so it's a lot more people. But I thought we had a really good productive conversation, and even the other towns are like, it doesn't make sense for us to give up power, but we understand where you're coming from because you are paying the lion's share of the budget and all that stuff. We made a slight tweak there, and I don't think this kind of tweak would be sufficient for the district, just given the delta and the levy percentage and all that stuff, but we did make a budget vote required 3/4, not just a simple majority. It still does mean if the 3 village board or the village representatives said, no, we don't want the new fire truck. The other ones can get the other 3/4 of the vote is fine. So but we had a good discussion and they understood enough to the point where they changed the agreement before we signed it, right? So it came up there. We had the same conversation. It just didn't get that because there was an agreement change that we were happy with before, village board and finance analysis and all that stuff. So maybe I didn't answer the question. Did you even ask a question? I don't know. It's late now. I did. Yes, this is going to keep coming up because we are the biggest ones in all the districts. And this is not uncommon. Again, all the villages he said are towns, Marshall, the rest. It's happens. You're gonna get, everyone's gonna get to a point where they're paying a lion's share of the budget and you go, are we just big enough to go off on our own? Then we have all the control and the policy and like, don't have to like, be dependent on other people, like you get to provide less of the budgets. Every growing community is gonna run.
I guess my last point would be, again, while we're not talking finance as much of what we think is in the agreement is about finance, there's just portions in the agreement, as I read it, that can have an indirect impact on safety. And that's what I'm thinking about when I'm looking at that agreement, and they kind of would be, right? Adjustments. And again, it's not the care.
I think
It's interruption of care based on some type of shift change, could be a boundary shift. Whatever that may be, that ultimately could impact care for those that are in our community.
I think that's a great topic. I don't think we can talk about, and let me try to summarize. The topic would be, we're looking at the EMS district, or I'm sorry, the EMS district agreement.
Yep.
With the finances side, there's some other non-finance stuff in there that's concerning to you.
Going through that.
I think we should talk about that. I don't feel comfortable talking about it because we have discussion regarding the emergency medical services report, which is pretty specific to the stuff Jay said, but I do think a future agenda item of maybe, because now we have the district agreement, we can publicly and transparently talk about, some of the non-financial concerns in it. And it would be a good time, because if the EMS district.
Oh, I think it's a great idea.
Does go to negotiations, right? We're gonna want this information in the
Yes, it'll come back to us and get asked to look at it later.
All right, anything else before I move on to the next topic?
No.
Okay. What does the group think about postponing this next topic to a future one?
I make a motion on that, yeah.
If
Really, says it's really quick. Let's just knock it out.
5 months, 20 minutes.
No, it's gonna take 2 minutes.
Okay, let's do it.
All right.
Oh, yes, okay, moving on. Discussion regarding proactive approach to the public safety.
So obviously, we've talked about this before, and in Kevin's point, he said a couple of them. I mean, we as a committee need to make sure that we're weighing the finance portion of it along with the public safety portion of it. But they're interchangeable, and we need to always consider that when we're making decisions. Obviously, our main focus is always gonna be public safety over financing, but we can't neglect that portion of our decision making, especially if we can stomach it. Well, that part of that also is just being a proactive committee, so, which means, doing some research. I just want to make sure that we as a committee, or you guys as a committee, are actively researching things, because as you can see, we have like 6 items that are coming up here. We're starting to see a little bit of influx of traffic stuff and different safety things. So maybe, I mean, I haven't talked to the chairman about this, but maybe assigning or you guys picking, hey, I'll look into that or whatever, so we can have good conversations and reports, so we don't end up with conversations like, well, I didn't know, or I'm not. Because then we're prolonging these things, and when we start getting into meetings where that we need to like hop on it because we've got deadlines and things like that, we don't have time. And what's ultimately gonna happen, and I believe this will happen, is you guys are a referral committee, so all you can do is recommend. And if we don't get on involved, we may be bypassed on a recommendation, because there are things that need to go to the board, especially budget items and those kind of things. So I think not only coming through all these topics, but anything in the future that we're actually, doing our homework, doing our research, and things that interest us or interest you individually. And obviously me as the quote unquote, your liaison, I can support you and provide guidance, provide data, have those conversations. I know Kevin and I haven't had a lot of conversations, Cameron and I have had a lot of conversations. surrounding these kind of topics, so I just wanted to put that up there for discussion. I don't think that there really is a discussion, it's just a point I wanted to make, especially with everything that's coming up. And some of these are hot topics, and, they're gonna require some due diligence from the committee.
So the recommendation on that is that, we can look at the laundry list of things that are teed up. Where one of us picks a passionate topic, like if there is one, or we assign each other, do some research and homeworks, and a little bit more prepared, so we can turn things around a little faster.
I mean, the chairman's position could just assign people, but I think that is not in the best interest of this committee.
Yeah,
I would do that.
I would hope that we would just decide amongst.
We would trade, you know.
And so we've done this before, if you guys remember, when I first took over, this was like, you guys weren't even meeting, some of you weren't even on the committee. There's 30 topics that were left behind, and we got through them. I'm just seeing a little bit of an influx, you know, and this is what we wanted. We wanted community engagement. So here you have it. So I just think to turn over things and to not let things just sit and wait and simmer, let's get on it. And I think, you know, each other's roles, you know, I get it, we're all busy, we're all busy, but just because of some of these things. So I did have, there was a couple items that I had to contact the people and just say, hey, we're gonna go long today. I don't wanna get this lost and have you do just that, where you're like, hey, we're gonna cut off this meeting, and I've got people sitting here waiting to discuss these things. So making sure that our agendas are concrete and, you know, within a reasonable time period. So, thank you.
I guess. Just to summarize, like, you know, I think it's unprepared, you know, and, you know, I mean, otherwise, I don't think we do this too often, but otherwise it's, meeting one, present all the information, wait a month. Meeting two, now discuss it, and, you know, we could do the, you know, a little bit of the research ahead of time. Like, not always applicable, but.
I would just add that I'm not suggesting that we're not prepared. I just think that our things on the horizon are coming that are gonna require us to be prepared.
Yes, that's great.
That I believe this committee is very strong and very good committee and really easy to work with, but I just think because of everything we got coming on, it's gonna require some extra work on our, you know.
I can work with you too, for time or two, like, like the firework thing. With,
So next meeting, prioritize one we could sign or get kind of a next step.
well, these will all come in the next meeting as discussion items. But I'll work with Chief Tony, just maybe the order they show up and it, and if the meeting ends up going long or whatever, we can take some of the more priority ones and just next one, whatever. Or, I mean, we get to the point where we have to meet twice a month to get to the, and I don't think people want that, so I think that was maybe the other point I made, but Chief Tony was saying, is let's. But, okay. Anything else on that topic?
Nope. Okay.
All right. Moving on, future items of discussion. So they're here. You know, ask questions, I guess, either to your Chief Tony, if you're unsure, but, you know, when you get the packet, you get the information, or even before you get the packet, you know, try to look at some of these stuff, you know, like the village ordinance for fireworks. I mean, that's on our website right now, but at a minimum, right now, you could look that up and do some digging before.
We have an engine braking, well, I think there's a group looking, so I can kind of summarize this. Stop sign in Valley Street, there's a group requesting a stop sign at Valley Street. There's a lot of new families moving in there, there's young kids.
This whole group got that 8 number, right?
Right.
Yeah. Okay.
Engine braking, it's another group out of Creek Crossing that's moved into that area. They continue to hear semis and those. We're currently monitoring that location at different times to capture that. If you drive out, that way you'll see our speed sign is out there to capture speeds and you can see what is actually happening. A one-way, has been proposed for Mill Creek Parkway. I know Kevin and I have talked about that, especially with all our events, and now you've got the building coming. However, that affects several businesses on that side of town and a big complex. So we're gonna have to hear from them and then make a recommendation, ultimately going to the village board. Fireworks, it's more about language, adding some languages. This is a topic that always comes up every year, and people are upset over it. You know, you have both sides, the things are going pop and people are, you know, they have PTSD or their dogs are having problems. So we have things that are going, we issued several citations this year. And we need to just word some things so people know exactly what is a firework, what isn't. It's in there, but it's kind of hidden. And I think we need to clean up the fireworks is the proposal. Electric scooters, electric bikes, and not so much skateboards, but the electric stuff, there are ordinances, there's already state laws that cover those. Some of the fines are extremely high and the people that are doing this are kiddos, you know, they're 10, 12 years old. So we need to probably look at an ordinance. It's all over the board. Most communities aren't taking this up. They're just electric bikes and scooters are considered bicycles, and so they just have to follow bicycle rules in essence. But again, that could be something that we look into. And then the last one is my addition is I would like to propose a inspection authority over massage parlors, and we can discuss, and most of you guys know why that is. So place is technically closed down, but we need some type of authority, so there are some ordinances in that.
And then the one that not listed here, you guys have the EMS district agreement in this packet. Just come, you know, we'll have something.
Definitely will have that one.
Discussion and possible action on current district EMS district agreement. Come prepared with any concerns you guys have with it, and we can.
I'll make that one our top priority.
Yeah, I would. Then we can enumerate something and take action and vote on it and approve it officially for the EMS district to. All right, schedule the next meeting.
I would propose that we not meet on the 16th. There is another meeting about this topic, so some of you may be interested in attending that. It's at the exact same time at the fire department. So my recommendation would be that we move our meeting just a week back.
Yeah, I apologize, but I didn't know it was.
And that's fine. I just noticed it today.
We go a week back, I would be out.
We can, otherwise we can go a week up. I'm just thinking, some of you may want to attend that and.
Is that on Monday?
No, it's a Tuesday. It's a Tuesday and it's a community meeting, so there isn't all the formal, there isn't gonna be public comment or anything. It's just basically the presentation and answering questions.
The main
From the
thing
public.
is, the main thing is we have to still post it as a forum, because there's possibility that you all are there, at the same thing. So if we're gonna meet here, then we wouldn't have to bother early to do anything about it, but if we move it, then I will propose that we.
Well, I think I'll post a quorum notice either way, because you guys might be there, some iteration of your committee.
So that would be my proposal, would be to move it up or down.
I'll
Up.
propose it's September 9th.
I will be gone.
Either
You guys
on the
can-
9th and 23rd.
No, not the 23rd. I'm on the 9th. I'm in a wedding and I'm not in, I'm attending a wedding in Washington.
How about 23rd?
All right.
Yes, 23rd.
I was thinking June 9th.
I got you.
You said that.
Sorry, no,
As long as we have we need 3.
I am.
I'd love to have
September
all-
23rd.
I'd love to have all
Yeah.
5 of you here, but. you
Right.
need- I think this is a very important one to have.
Is that what we're playing? I don't know how we're gonna make that by 5:30. That's crazy. Yeah, that's.
Yes, 20, I think I hear 23rd at 7 is Candace.
Yeah.
Right there, okay.
Oh, come on.
I'll be
We can-
cheering for you.
Okay.
Okay.
I mean, if it's gonna be.
They don't like to run it this fall.
Yeah.
Wait, night.
We can do 6 if you guys want. You guys can make it.
Wait,
6 o'clock.
That's 23rd.
Yeah, if you want to do it the next one.
I work just.
Okay.
Let's just
We'll do 7.
let's just do 7.
And like I said, if we don't get through enough of the topics, we can schedule an ad hoc one some other time, right, between.
All right. Sure. Okay. Wait.
I will.
Shoot. I'm okay at September 9th.
Oh, boy.
I am so sorry.
Okay, September 9th it is.
Or no,
Okay.
well, 16. I'm good the 16th.
No, the 16th, we're at the firehouse.
Oh, yes, okay. I can't use, I can't.
It's getting late, huh?
Okay.
Yeah, let's adjourn this thing.
Good with the 9th if that works better.
9th or 20th. I make a motion, we table the discussion.
Yeah.
The next meeting.
September 9th?
September 9th, seven
Okay.
PM.
And that's a Tuesday.
Yes, that's a Tuesday. I'm so sorry, I flipped to October, September 9th. I will be in Washington DC on October 9th.
Can we take a proactive approach to do the September 9th? Is that right?
Yeah. Okay. Sorry, guys. That's, I don't know. All right,
It's adjourning.
motion to adjourn.
Make a motion to adjourn.
Oh, sure.
It is going on. And,
You wanna take this back?
all right, motion